So this video is about strokes. Now, this sign is you put your open 8 hand on your forehead, and then with your left hand, or the hand you don't write with, is just does nothing, and it hits stroke. This is heart attack, and this is stroke. So it's the same sign, but it's in a different area of the body, because a stroke usually comes from the head and a heart attack is from the heart. So that's why. So I thought that I would kind of, really kind of focus and concentrate this on women, because most of the time all of the stroke symptoms and warnings are about men. So I've had a coworker that's had 2 strokes recently, and there's only one thing on the risk factor that she has. So I'm going to go through that. So it says that the warning signs, first of all, it's hard to talk or communicate or to be able to understand other people. Also, it's hard to move like your face or one of your arms. You can't lift it up. If you ask them, there'll be one that won't, and then the face will droop or whatever. And then, or even a leg, it's hard to move. Also, vision changes. And then they have this sensation, this feeling. It's decreased, mostly on one side or the other. And then they may have a really horrible headache or dizziness. They can have confusion, and they change in if they're alert, attention, or focused. Alert would be surprised or eyes open. And, if you see them kind of trying to be sleepy, that would be an alertness thing. Or they could have a seizure. Now, the sign for seizure is head, and then this is like sleeplessness. Your bent V hand, sleeplessness. I can't sleep. I'm restless. And this is seizure, where you're rolling around. That's an old sign for seizure, but it's still the sign for seizure. So anyway, it says that the symptoms for strokes in women are fatigue. I'm going to say very tired. This is tired, and this is just laid out. Very tired, or they're weak. Their confusion. They have a hard time thinking clearly. Nausea or vomiting. And then here's the risk. I'm going to do this sign for risk instead of dangerous. This is the risk factors. And it says like a group of people would be black women and men too, because of the sickle cell issue, and it's only black people. I'm gonna say that because that's how deaf do it. Black people instead of African American, but we can say African American if you sign black. Sickle cell disease, and they are at a high risk for blood clots, and so that's why it can cause a stroke. Many times, if a woman is pregnant and has high blood pressure, it can cause a stroke. I've seen that. I've interpreted for that. Also, some birth control or hormone therapy can cause a stroke. I'm sorry, my nose itches. I don't want to sneeze. And then also, like if you are obese, this is the sign for fat or obese. So be careful of your BMI and high blood pressure. Now, my coworker, my friend who had the 2 strokes recently, she's thin, she's young, she doesn't smoke, and she doesn't use drugs, and she doesn't drink alcohol. So what was her risk factor? She has migraines. This is an M, this is a headache, but a migraines. And so they see auras or different colors around objects and people. So she has the migraines with the aura. And so it causes like, dizziness and speech changes, ringing in your ears, and vision changes. And they said those vision changes are like they see lights or a zigzag. And so she has migraine headaches, and she's had that for a long time. So that's her risk factor. So and then for men, it's a little bit different. I mean, it's the same. I think there's some things that are always going to be the same, like obesity and things like that. But I did want to, um, specify for men because it's a little bit differently. And they're, um, they talk about their risk factors are the same. Is the smoking and overweight, diabetes, too much alcohol, and not enough physical activity. And they were talking about that more black men and Hispanic. I'm doing Spanish, so it's not necessarily Mexico or Mexican. It's Hispanic. So I'm doing Hispanic men that are at high risk for a stroke. And it says because most of those two groups or populations have diabetes or they're overweight, and so and I think that's those or they drink a lot of alcohol, but white people do too. So they said to prevent is to take an aspirin, but to ask your doctor and to try to control your blood pressure and your cholesterol. Now, I'm doing C cholesterol because you take your blood, and it's so cholesterol's in your blood, the fat content in your blood, and then the smoking. They would advise to quit and to eat more healthy and have regular physical activity. So you can walk or swim or, if you want to jog, but exercise just to get it out and doing more of that. So but there was something that was so they said to remember fast. So your face, is it like you're smiling and this side's drooping? Are your arms, do they feel, this is numb. So sometimes if I do numb, I'll just do this. But really, if you want to have a correct difference, because we are going to do the difference between numb and paralysis, then you would do feel nothing. Like, oh, does it feel nothing? Can you feel that? I feel nothing. So that would be the true definition of numb. I can't spell today. Numb. Or it can be tingly. Like sometimes you feel like the heart and it's tingly. And then paralysis, frozen, like ice or frozen. You can't move it. Like, can you move it? Oh, both arms. You can't. So that's paralysis. So those are the three things that are very important on those signs. Is numb, feel nothing, tingly, and paralysis. I can't move it. And then on the speech, is it slurred? Now, a person that is signing would probably not have control of both of their hands. They may only sign, with one hand, or have difficulty doing that, or they can't. I had a deaf woman who had a stroke during her pregnancy, and so after the baby was born, then she was doing a lot of therapy, and she could not move one side. And I can't remember, I think maybe the left, but she can only do things with this one hand. And so they had to work with that on the left. So to learn to do things with the right hand only instead of both, but also try to get that strength back on the left. And then I saw her a few years later, and she was fine. And so, but it's just continually with that therapy to work with that. So she could only sign with one hand, and it was just kind of like I had to really watch her and make sure that I knew what she was signing. So that's how you can tell for a deaf person. It's only one hand, and then they're only, it's like it's not clear with one hand. So that is slurred speech with a deaf person. And then they said time, because FAST. So F is face, A is their arms, and then S is their speech or their signing, and then T is time. They say, so if you see any of that, if you're noticing it, so it's been there for, at least a few minutes, then they say to call 911, of course. So, so that is for all people and not just men or not just women, but they do have a little bit different, and so that's why they wanted to have it. And I really appreciate them doing the differences, because women are different, and it's they're going to have the headache and the vomiting and the nausea. I had a former boss, we didn't know she had an aneurysm, and she would go into the bathroom throwing up, and so we weren't really sure what was going on. Of course, then she died at the hospital, but and there was nothing that we could do with that. Oh, they also said if women or even men, if they feel kind of like faint, like they're going to pass out, you can. That's another symptom. So which I didn't say that on the other one, but so they were saying they're trying to reduce the cholesterol, lower the blood pressure, and the blood to thin. So that's why the aspirin. And I had one deaf person, and it was kind of funny, but it's not really. And so the doctor was asking them if they were taking aspirin, and they said no. And they go, "Are you sure?" I go, aspirin, and you take it? And no. And I tried different ways. Come to find out, she had bought some Excedrin, and so she said, "I'm taking that." So she was just thinking about the bottle. The name on that label on the bottle was Excedrin. So you might, and I think I even said Bayer, and then she said no. But I didn't even think about going through the list of all the aspirin names. So you might want to do that, or is it medicine for a headache? Sometimes they know that, but sometimes they don't. If they're not accustomed to taking medicine, they maybe don't know. So it's not like they're stupid or anything. It's just they don't know. If they've not been exposed to that, they just don't know. So be careful with that. And so you might want to look, and so you might want to go through the names, because she really was taking an aspirin, product. It just had a different name, and the doctor was using that generic. So they also said another risk was age. And like I said, my coworker is young. I mean, she's in her 40s. So and she's very thin, and she eats healthy, and she doesn't smoke, and she doesn't use alcohol, and she doesn't use drugs. So, but they said that an age, because your heart arteries, and I do this because it's a bigger, if I did veins, it would be thin with this sign, but the arteries, they narrow, and so the blood can't get through fast enough. If you have diabetes, so all those things, and family history. And so that's very important if people know of the family history of strokes or things like that. So anyway, they do say that some birth control products for women is a risk factor, so to be very careful and ask your doctor and know the percentages for the stroke, and maybe use different birth control or hormone therapies. And I do hormone like this because it goes through your body: metabolism, hormone, circulation. So it goes through that. Okay, so those are all the warning signs and the risk factors for a stroke. And I thought this was a very important topic, especially because I noticed that my female friend had 2 strokes close together, and she didn't have the normal what you think of risk factors. But when I looked it up and I noticed that it said migraines, I knew she'd had migraines for a long time, and she has them fairly frequently. So be careful with your friends. Tell them, have a conversation, and know these signs, and also the signs. And so I hope you have a good day, and I will see you later. Bye.